room you're in?
Yeah, this is
Hi,
not a stream.
everybody. Nice to have you here. I'm Leslyn Keith. I'm with Lipedema Simplified, and we've been getting together recently talking to our speakers that are going to be at our event coming up on April 17, 18, and 19. It's a virtual event, and there are links down below for you to get more information and to register. It's only $97 for the 3 days at this point. So be sure and sign up and find out more about it as soon as you can. But what I've been doing is meeting with some of our speakers that are going to be at the event, so you can have an idea of what is going to be happening there. And I'm so pleased today to have Amy Berger, who has spoken at other events of ours before, but we love having her, and she's going to be here again. Hi, Amy.
Hey, how you doing? Good to see you.
Good. And I want to just give everybody a little bit of information about you in case they don't know. Amy is a certified nutrition, I guess, specialist is what you're calling it, a CNS. She has a master's degree. She was in the Air Force, but her specialty is helping people do keto without the crazy. She's written a wide range of health and nutrition related topics, including weight loss, diabetes, Alzheimer's disease, thyroid function, and more. She is going to be actually presenting at our conference about thyroid. So that is going to be super interesting. She has done several books, one, The Stall Slayer, also End Your Carb Confusion, which she wrote with Dr. Eric Westman. And she's also the lead nutritionist for the Adapt Your Life Academy, where she creates the course content and she coaches people to help them use low carb and keto diets safely and effectively, and as we hear, simply. So I'm so happy to have Amy here. I've known you for several years, many years, and always see you at different low carb conferences. So it's so good to have you back again and to be speaking at our conference.
Yeah, thank you. I love being with the lipedema community.
Yeah, and Amy, you have some experience working with women with lipedema and also with the lymphedema population and in your practice.
A little bit, not a ton, but some.
And one thing I didn't mention in Amy's introduction is that she also sees people privately. And so we'll have a link down below if you want to get in touch with Amy to do some one-on-one coaching, but also do check out the link for Adapt Your Life, that if you want to be in a group program, which there's so many benefits to being together in a community, check that out also for help with adopting a low carb or ketogenic diet with that program. So Amy, tell us a little bit about what you're going to be talking about at the conference regarding thyroid.
Yeah, I am so passionate about thyroid. If there's anything I'm more passionate about than low carb and keto diets, it's thyroid, because I've been through it myself. And I'm sure a lot of the people watching and a lot of people in the community know that there is a pretty decent overlap between lipedema and hypothyroidism. It's not that one causes the other, but they just very often go hand in hand. And basically, I'm gonna give an overview of what the various thyroid hormones are and what they do, and why it is so unfortunately common for women to be told for years that their thyroid is normal, never mind the fact that they can check off, 6, 8, 10 symptoms. And they've been told forever, your blood work is normal, it's not your thyroid. And it's just unconscionable. And so I really want to equip people with information to be able to advocate for themselves and get the help they need if they have a thyroid issue.
Mm-hmm, mm-hmm. I remember working with one patient who had hereditary lymphedema, and she also had bipolar, and she was on long-term on lithium to manage the bipolar. And it is well known that one of the side effects of lithium is hypothyroidism. Yet, because her TSH was normal, her provider refused to investigate hypothyroidism, even though we knew that her medication was probably contributing to this. And so there's just a lot of unfortunate misinformation in the medical community about thyroidism. What can we do as a community to help have the medical community catch up with what's happening with thyroid?
I mean, there are some good doctors and nurse practitioners and all out there. They're rare, but they are out there. So, I mean, one of the things is share. If you have a good endocrinologist or just a good provider, tell everybody, you know, and but really, again, just to educate ourselves, and then we can maybe find the right provider rather than just, oh, I'm just going to go to this endocrinologist and hope for the best. Because it really is, the testing and treatment is just kind of in the dark ages when it comes to this. And I don't think it's kind of like keto, the change or the acceptance of, let's say, more nuanced thyroid testing and more forward-thinking treatment is going to come from the ground up. It's going to be like a grassroots movement. It's not, we're not going to change the medical establishment. We have to sort of change ourselves and our own thinking and then work, you know, individually with people. But we were talking offline before that I'm actually working with the nurse practitioner who is pretty well known in your group, Carol Rosemith. We're writing a book about thyroid, and our aim is to make it's kind of 2 books in one. It's written for the lay people like us to just understand, why do I feel like garbage, even though my doctor keeps telling me I'm normal? And Carol is going to write more of the medical side to speak to the professionals like, hey, I know this is what you learned in medical school, but here's why it's wrong. And here's how you can help so many more people. So, you know, hopefully that will go some way to changing it. But there's a doctor named Antonio Bianco who wrote a book called Rethinking Hypothyroidism. He's a former president of the American Thyroid Association.
Wow.
This book came out, I think, in late 2024, possibly 2023. I don't remember. But he basically comes right out in that book and apologizes to all the patients over the years who he basically gaslit, not intentionally, but he was trained at TSH, that's it, and nothing else matters. And so I think that the paradigm will change, but we don't have time to wait until it does 50 years from now.
And since the hypothyroidism is such a common comorbidity of lipedema, but some people with lipedema may not even know that they have hypothyroidism. Could you briefly talk about what symptoms someone should be looking for that might indicate that they have low thyroid function?
Yeah, there are a ton. So I'll just mention the ones that are the most common sort of hallmark. But if somebody watching this, you don't have to have all of these. But if you have a few and you're like, yep, sounds like me. Yep, sounds like me. But also, if you have a lot of things that I don't mention, it could still be thyroid, and they're just some of the less common ones. So the thyroid hormones regulate your metabolic rate. So one of the biggest is unexplained weight gain or an inability to lose weight. Like even with a good diet, even with exercise, the weight is just either coming on or you can't lose any. Fatigue, because your body literally is not generating energy. So fatigue, feeling cold all the time. Before there were advanced thyroid blood tests, old school doctors used to diagnose low thyroid based on your body temperature. And I know some really good doctors still will ask you to take your temperature every day. Depression is a big one. I think there's a lot of women taking antidepressants when what they actually need is thyroid medicine. Hair loss, constipation, brain fog, high cholesterol, which of course can come from anything, you know, a lot of things, but that's really the handful of the biggest ones.
Yeah, and we see all of those symptoms kind of, you know, they're not diagnostic of lipedema, but they seem to go along with lipedema. And so there may be a lot of people out there with lipedema that have undiagnosed, unknown to them, that they might also have hypothyroidism. One thing that you talked about was like unexplained weight gain and just inability to lose weight with diets. And what we're finding is, well, that's a characteristic of lipedema. But if we use a low carb diet, they do tend to lose weight. But if you're one of those women with lipedema and you've done keto and it didn't seem to respond, maybe we should be looking at thyroid. So this is such good information for people that have been trying to do everything and doing the recommendation, the cutting edge recommendations, and still not successful. This is something really good to investigate. Thank you, Amy, for bringing this information to us. But let's talk about well, I'm sorry, go ahead.
Yeah, something else that happens to a lot of people with thyroid, myself included, before I was medicated, the lower legs actually tend to swell up. You get that lower leg edema. So if you have lipedema, it might be kind of hard to tell, but let's treat the thyroid so we don't make it worse. Let's not compound the lower body issue. But it would be, it's not always fat storage. I think it's just edema. It's like a lot of fluid buildup, but definitely my legs were very swollen before.
And was it non-pitting edema that you had?
I think so. I mean, it did not look like lipedema fat. It was a very different look, but again, like if someone has lipedema, let's not compound it by having this thyroid issue on top of it.
Yeah. Well, and this is, again, another issue with lipedema is that they tend to get swelling in the lower legs that is, part of it's fluid and part of it's fat. But if you press your thumb into it at the shin, it doesn't leave a depression. So we say it's non-pitting, a symptom of lipedema. But is it because you also have low thyroid? I mean, there's so many symptoms that overlap. And so at least it's worthy to investigate this with an educated, up-to-date healthcare provider. That you might want to look at that. If you're not getting good answers from your primary care, look elsewhere. And I've found that it's interesting that endocrinologists tend to specialize, and they're either doing hormone replacement, or they're doing diabetes management, or they're doing thyroid. It's hard to find someone who would do all three, which in the lipedema community, it's kind of important to have all three, and you can't go to the same endocrinologist for that.
I will say, though, unfortunately, when it comes to thyroid, endocrinologists tend to be the worst. So sometimes they tend to be the most conservative, the most in the dark ages. Not all of them, but, and any medical professional can order thyroid labs, can prescribe thyroid medicine. They might not be as comfortable doing it, but they can. Any MD, any DO, any nurse practitioner, people automatically assume, oh, if this is a hormone issue, then I should see an endo. Yeah, maybe, or that person is going to tell you, oh, your TSH is normal. See ya. It's just honestly, it's like a crapshoot trying to find a good provider. I mean, Carol and I, one thing we're going to try to do is build a network of like-minded people, because it really does no good for us to, like I said, educate people that need this information if there's nowhere for them to go to get the treatment that they need.
Right. So you're talking about like having a provider directory, so people would be able to find someone near them that look at thyroid the right way.
Yeah. And there's one or two out there that exist. So like I'm able to kind of steer people in the right direction, but I'd rather kind of she and I like make our own.
Yes. Yeah. I think that would be good. And one other thing I wanted to talk to you about with thyroid, and since you're presenting at our Heart to Heart conference, is there a connection between low carb or ketogenic eating and thyroid function? And what is it?
We get this question a lot because there's a lot of misinformation out there, like, oh, women shouldn't do keto because of thyroid, or keto kills your thyroid. And the fact is, there are some people who have hypothyroidism. They go on a low carb or keto diet and they're able to reduce or actually stop their thyroid medicine. Like keto actually normalizes some of these hormones. Not everybody, of course. And I think for the people who do run into thyroid problems on a ketogenic diet, it's not from keto per se. So many people, for some at least, keto suppresses the appetite so much that they are inadvertently under eating. And so their metabolic rate kind of slows down in response to that. But that's not because of keto. That's because they're just not eating enough. And this is a recognized thing that would happen on any diet if you're not eating enough.
Right.
And
I think that is a common issue with women with lipedema who have battled with their weight all their lives. And what they've always used is to limit their meal size. And so, and not respond to any hunger. They suppress that. And so they feel satiated on a ketogenic diet. And this is a common thing, to undereat. Encouraging people to go ahead and have maybe for some people like that, it would be good to have like macros to shoot for, to make sure that they're eating enough.
Yeah. And I think in the keto and carnivore communities, we also over glorify fasting a little too much. And people think like, oh, I should only have one meal a day, or like fast for 3 days a week. And if that's working for you, great. But I think, and I do know there are some people who do really well with fasting in lipedema, but not everybody. And I think that's another thing too, that it's just, we overemphasize fasting.
Yeah. We have a person, okay, this is from one of our listeners right here. I started to gain weight while still eating, I don't know which diet. She said, I originally lost weight on. Leg swelling got worse, joint pain, constipation, fatigue, hair falling out, and just found TSH high in January. So, and I'm curious to this poster, which diet you did, because that sounds like a typical response to maybe a low calorie, low fat diet. What do you think, Amy?
I'm guessing she probably means keto, since we're talking about keto, but I don't know if she'll have to specify. But yeah, this person says her TSH is high. So there you go. This is probably hypothyroidism. But just as a preview of what I'll be talking about in April, if your TSH is high, that classically indicates low thyroid. But there are so many people who have a completely normal TSH, but their actual thyroid hormone, TSH comes from the pituitary gland, not the thyroid gland. The actual thyroid hormones are low, and the TSH doesn't always reflect that. So I think it's way more important to go by your symptoms more so than any one lab test.
Yes. Treat the symptoms, not the numbers.
Amen.
And here we have another poster who says, what are the thyroid labs that need to be ordered? And I know you're going to be very specific about that in your presentation. But can you briefly let us know for our listeners right now?
Yeah, but I got to warn you, a lot of doctors just flat out refuse to order some of these. Depending on where you live, if you're in the US, you can order these on your own without a doctor, but then you still might need a provider to do something about it if it turns out your numbers are not where they need to be. So I do recommend the TSH. We just don't want to do only the TSH. So TSH, free T3. Free T3 is probably the most critical one. And then you could do total or free T4, reverse T3. And if you suspect there's an autoimmune issue, you could do thyroid antibodies. But the fact is, the treatment is largely the same. It's not that much. If you have Hashimoto's versus some other form of low thyroid, you're still going to need the same kind of medicine, the same approach. So
yes. And I think the issue is that doctors don't like to order labs that they don't understand, they don't know what to do with. And so, again, you might have to find a provider who actually understands this in order to get them to order the labs for you. And so, always going to ask you something else, and I just forgot what it was. Go ahead, Amy.
I don't want to speak out of turn, but I know this community. You all know Siobhan Huggins.
Yes.
Do you talk to people about Own Your Labs?
Yes, yes. And so that is, and so yes, people can use organizations like Own Your Labs, and you can go to ownyourlabs.com. Siobhan Huggins and Dave Feldman run that. It is a place for you to go ahead and order your own labs. They have a doctor on staff that signs it off and allows you to do that. There are certain states that don't allow that to be done, and I can't remember what those states are.
I think it's New York, New Jersey, and Rhode Island, and I think there's limitations in Maryland and Massachusetts, but I'm mentioning Own Your Labs because they have a thyroid check-in bundle that includes all the things I mentioned, and then they have a separate one that costs a little more that also includes the antibodies. But if you go to ownyourlabs.com, you can just search thyroid or thyroid bundle and you'll find it.
Yes, and Akanksha, who's handling everything for us in the behind the scenes, she just put that link down below, so you can go to Own Your Labs and see if your state allows you. Again, this is in the U.S., but there are lots of these organizations that allow you to order your labs, and so if you're outside the U.S., you might need to go to someone else. Yeah. So yes, that I think that is going to be super helpful for you to actually find out these numbers. But again, you got to be able to go to a provider who's going to know what to do with them and how to treat. And specific to that, do you have any particular thyroid medication? I mean, there's synthetic, and then there's more, I guess, organic, made out of other animals' thyroid. I mean, do you have a preference in medications that you like to use?
So yes and no. I mean, I can't prescribe medicine, but if I talk to people about it, or kind of what I would recommend if I could give them medicine, I don't think that natural is necessarily better than synthetic. There's really only what works best for the individual person, and it is very individual. That being said, the medication that is typically prescribed is levothyroxine. Most people know it by the brand name Synthroid. That's basically the standard go-to thyroid medicine, and it works really well for some tiny bit of people. There are a lot of people who need Cytomel or liothyronine, which is a T3 medication. The levothyroxine or Synthroid is T4 only. Or you could take something like Armour or Nature-Throid, which is the natural desiccated thyroid, which still gives you mostly T4, but it gives you a little bit of T3. And I see this all the time, people who are on thyroid medicine, but they still have all the same symptoms they had before, which is, to me, a pretty strong indicator that that medication is not working.
Right.
And unfortunately, that is the go-to, and a lot of doctors, for reasons that I may get into in the talk in April, they refuse to prescribe T3 medicine. So now you can get it, you just have to find the right practitioner. But it's, if anyone out there is on levothyroxine or Synthroid and you still don't feel well, you might, your body is probably not converting that medication into the T3, which is what your body really needs to have that normal metabolic rate and relieve all the symptoms.
And it doesn't work to just have T3. You also do need T4.
That's a good question. So there are some people who take just T3. That is a thing. Again, a lot of doctors don't like doing it, but you can. I don't think there's anything dangerous about it.
Okay. But it may not work. You may need to do, because again, the T4 is what your body converts into something that you can actually use. So by taking the T4, does it stimulate your body to produce more T4?
I know, if anything, I think taking thyroid medicine actually reduces your own production because your
Oh,
body's like, oh, there's plenty coming in. We don't need to make
it's
any.
here. Yeah, yeah.
Yeah, but I
Interesting.
don't think that's necessarily a problem because
Okay.
you wouldn't be taking it if your body was producing enough of it on its own anyway. Like the reason we're
Right.
taking it is because our body isn't making enough.
Right,
So,
right, right. Interesting. There is so much to talk about on thyroid, and we're so appreciative of you coming once again to talk to our community and be at our Heart to Heart event. Again, this is April 17, 18, and 19, a virtual 3-day event. The information and links are below. So be sure and look that up and register and join us. Amy's contact information is also below, and I believe also Adapt Your Life is below. So check out all that information. Get in touch with Amy. She would be so helpful to you.
and
Amy,
can I say one
yes,
last
go
thing? Do
ahead.
we have time? So,
Yes, go
and
ahead.
my website is very much under construction, so don't expect a lot there. It's a brand new thing that's not really built yet, but there is a contact form that you can reach out to me if you'd like to. I just want to say that with women, and I know, unfortunately, women with lipedema know this only too well, that, or you may go to a doctor who just dismisses you outright. Again, your TSH is normal, there's nothing wrong with you, or it's not your thyroid. You have to fight for yourself. But more than that, so many women have been conditioned to almost gaslight themselves, like, well, I'm really tired, but I'm just getting older, or I'm depressed, but I'm in menopause, or I'm just getting older. This is normal for me. I always have fatigue. I'm always this way. Well, are you, or are you low in thyroid? And I
Mhm.
feel like women tend to explain away
Yes,
things that could be fixed, and you could
yes,
feel better and
yes,
enjoy your
yes,
life. And
yes.
I just see it so often, women sort of like brushing it off. And I'm like, don't do that to yourself. You deserve
Mhm.
better.
Yes. Thank you. Thank you so much for that, Amy. That's wonderful encouragement to hear and have everybody know about. Again, thank you for joining us today for this Facebook Live. I so look forward to seeing you at our event and future low carb and other events. Again, everybody, be sure to check out our event and see you there. Thanks.